Under the leadership, quote unquote, of current HHS Secretary Kennedy and Donald Trump, the greater public health apparatus is in the process of firing thousands of workers at HHS, NIH, and the FDA. FDA has seen proposals to slash 20% of its workforce, including 170 of those from the Office of Inspections and Investigations. And I just want to note that when we talk about efficiency, that's a word that gets thrown around a lot. We have to actually talk about what we mean when we talk about efficiency. What is the time frame we're looking at? What are the goals and parameters we want? If I want to lose weight, the fastest way to do that is maybe just cut off my leg. That is not an efficient way if you're thinking beyond the immediate term. And one can argue that the cuts to FDA are having a similar effect. In particular, I want to talk about the effects on the drug approval pipeline. I've been told by a lot of the life sciences companies that I represent in Orange County, California, that many of those drug approval people are actually paid for by user fees. So by cutting these people, by terminating staff, you are creating potentially a much longer pipeline for drug approval, product approval. And again, these are positions that are paid for out of the user fees. They actually don't cost the taxpayer anything. And so when we look at efficiency beyond anything but the immediate term, these cuts look very counterproductive. They look like they're going to have massive negative economic impacts on our communities, on the drug pipeline. And when we talk about efficiency, I just want to note another thing that's happening right now. The attacks on immigrants, particularly in higher education, the cuts to NIH are having massive impacts on universities around the country, including UC Irvine, which I represent. They're very worried. I know that many of the immigrants that are researching potentially groundbreaking efforts in new life sciences products and drugs, that many of them are going back to their countries of origin. They're going to other countries and other top research institutions. Dr. Kessler, if you can speak about the administration's immigration actions and how you anticipate they might affect our life sciences industry here in the United States.
Our competitiveness was enhanced by those people coming to universities in your district.
They made America great.